Assalamu alaikum. My name is Dr. Aminu Mohammed, National Health Insurance or University Health Service. Let's discuss, and I say is an umbrella term they use here. But maybe I'm going to hit on different issues. Health, I think I will dwell more on preventive aspect than discussing curative aspects. There are emerging issues, so I'm going to talk fast. There's limited time. Let's start with the health service as a whole. If you come to the health service, even if you don't know anybody, you can walk up to me because technically all of you are under me. There's what we call the tertiary institution social health insurance program. Now, that was actually introduced by the federal government to reduce the financial burden regarding health issues for any student of post-secondary education. So once you come in, all of you, what we do is that we try as much as possible to capture you. As soon as you make your registration, we capture you into the social health insurance program so that you have services that are covered by your medical fees. Now, we'll dwell more on preventive issues. My advice, all of you here are ambassadors. You are our ambassadors. So you have to stay healthy. Now, the first advice I will give you, try to have time to rest. We all have different programs, but resting is key. Have adequate sleep. You see, you have to be healthy for you to study. So sleep is key. I didn't say you should oversleep, but you have to find time to sleep. And secondly, when you feel symptoms that persist beyond 1 or 2 days, please, you can walk up to the health service. Your services are free. And you are covered. That was why I started with the social health insurance program. Your services are free. You are covered under the social health insurance program. So you can walk up to the health services so that you'll be tested or screened. You'll be treated appropriately. The mistake some of us make is we turn to nurse issues. We feel like it's just headache. I can tell you 100 diseases that start with headache as a symptom. So it's not just. Once you feel any sign of unwell, walk up to the health services. And usually what we do now is we try as much as possible. Once you've made registration, we have your database so that when you come over, all we have to do to get your biometrics, and that is all. Whenever you come, we try to see you as much as possible via automated method. Thirdly, your hygiene. You know, in school, you don't get all the things you require as you get at home. Try as much as possible. Even just your drinking water may be a source of problem to you. So that you should take care of. Now let me give you an instance that happened one time. I was posted to Congo, and one particular evening, 3 people came with itchy rashes. When I say itchy, I mean itch. Swollen, signs of reaction. They were all coming from the same hostel. The first person I saw, I treated. The second person, third person, I say, oh, we'll have a fourth person. Don't trace this. Now, what they presented with was actually a sign of a reaction. Yes, for those that goes to farm, there's this worm. Once it touches you, you have that reaction. So that actually put a spike in me, and we decided to trace the source. You know the funny thing? That one was inside the tank that is used by the hostel. So all of them got their water from the same source. And then we have to empty the tank that night. Then there are instances again, outbreak of gastroenteritis, including things like cholera. You know, your drinking water is not actually key. And they say water sustains life. Funny enough, water can never be 100% pure, or you have to decontaminate as much as possible. I know we are students, but there are certain things you can do to decontaminate your water. There's this water guard we use. You can actually use it to decontaminate your water. Because during outbreaks, all those that came down with it didn't bargain for it. So you try as much as possible to ensure you get good source of drinking water. Or you treat the ones you have. You can boil it. You don't have the means to get a water guard. You can boil your drinking water. Then there are emerging issues actually. How many of us know that there's an outbreak of hemorrhagic fever currently in Kaduna State? If you are aware, just raise your hand. Few of us. There's actually an outbreak of hemorrhagic fever, and we are thinking of Lassa fever. But it's actually being contained at the moment. And there are certain healthy tips. Most of the time, you don't get infected with this disease. It's actually a viral infection. And the commonest way to contact it is through contact. You come in contact with a person infected with it, you can actually come down with the disease. And the commonest source of the disease, vector for it, is actually rats that were isolated. So another thing is guide your foodstuffs. You know, I try as much as possible to be as simple so that you will be at the same level. Try as much as possible, especially grains. Because some of you, your hostels, they are nothing to write home about. Actually have these rodents infiltrating through your foodstuffs. So try as much as possible to protect these food so you can cover them, prevent them from getting to it. Because their feces and urine contain this virus. And it can I'll use this medium to get you. There's a reason why the health service is there for you. It covers you. You discover that even if you are sick somewhere and you are treated over there, once you come down, they will tell you to get a report from the health service. Please, whenever you have health challenges, come over to the health service. even if we end up referring you, who will give you that coverage? So you know that now, so that you don't get fixed up. Because whenever you come with a report from outside, they will tell you to authenticate it. Only way you authenticate that is through the health service, which is actually a rigorous process. So try as much as possible to utilize the health service. There's actually a lot to talk about. My discussions are usually interactive, but they are time bound. So abide by it. With these few tips, if you have any questions or anything, you can contact me outside this forum. I'll give you all the answers. Thank you.